during the course of today's call, you can certainly ask your question. Hang on just a second. I think I have to log in here. But we will have this as an interactive call, so please feel free to use the chat and chime in anytime you need to. We'll get started. This is our agenda. We're going to just briefly go over the data submission and the schedule. We will, update you on any new reports that have been posted in the member folders that are generated by Haney's, the Hospital Association of New York State, DataGen. We'll talk about the new data export tab, which went live yesterday afternoon. I don't know if anyone has had a chance to look at it yet, but it did go live, and we'll do a brief demo on that. Sharifa's going to go over some information on the UBO4 form and the use of NPI numbers for facilities, and then we're going to briefly talk about new facility users, vendor updates, and then also have an open forum for questions. As always, I like to just briefly go over for any new users. We may have the kind of outline or the overview of the Georgia Discharge Data System. Hospitals submit their data in the UBO4 data format to our vendor, Heidi, which is a subsidiary of the Missouri Hospital Association. That data is then put through a series of data audits and checks, and we also review that data. Values are assigned to the data, such as calculated zip codes, DRGs, service lines. That becomes the Georgia Discharge Data System, and that is distributed or submitted to the state of Georgia, the Brain and Spinal Trust Fund Commission, the Agency for Healthcare Research and Quality, and the Healthcare Cost and Utilization Project. It is a state mandate that this data be submitted to a state law that the data be submitted to the state, and we do that on your behalf. GHA also uses that data internally for purposes at the Capitol on your behalf. Also, we make this available back to you for participating in the data program on our web-based platform, the GHA GDDS Strategy and Marketing Visualization Tool, which we'll be going over later. This is the schedule. Sharifa, do you want to give us an update on submission and when the next deadline is?
Yeah, the next deadline for September data is in about 10 days on the 15th of November. And so I see that people are submitting their data. If you have any issues or concerns about not being able to submit on time, let me know. So that'll be the end of quarter 3. And then we have just one more quarter left of data. So again, if you have any issues submitting or any corrections that need to be made, even for previous months, you can make those corrections before the close of the database so that it can be refreshed with the release.
Great. Thank you, Sharifa. Mm-hmm. And now Sharifa's going to go over the Georgia UBO4 record layout. So Sharifa, I'll just turn it over to you.
Okay, thank you. As Leslie mentioned, the UBO4 layout or the format is the format your data file needs to be in when you submit it. And there were a few facilities who were having issues or were not submitting their swing bed data or their psych data, which require separate facility NPIs. And so I just wanted to discuss that and show you where and how to enter that information so that your data is correct and those, the swing bed or psych is separate from your regular inpatient data. So the first field is for the record type, as you can see here, illustrated, and it's in the first column. And then your second field would be for your facility NPI, and you can have multiple NPIs, so it goes from column number 2 to 16, and that's where you would enter that NPI number for your psych or swing bed or whatever other NPI number you have for your facility. And so, and as we know, and a lot of you may know that the facility NPI can be used to identify patients from a specific wing of your facility. And so specifically for Quality Works and other programs that you may be participating in, you need that separate NPI so that the data can be, I guess, can show your separate services that you offer. You can go to the next slide. Okay. And again, and this information is, you can also find it in HIDE-Net under the documentation tab. And this is the patient type definition, so you can review that if you have any questions regarding how to put your bill types in, because that's also something that a lot of facilities were doing, is that they would put the separate NPI but the incorrect bill type. And so if the bill type's not correct, it's still not going to pick up your swing beds, for example. So you have your inpatient bill types, and the 111 is the most common. And then for swing beds, you have, 180, 181, 184, 185, or 187. So anything other than that is not going to pick up as a swing bed case. And then you have your other patient types, like your ambulatory surgery, emergency, etc. So for the swing bed bill type, make sure that the bill type and the separate NPI are entered correctly. And again, for programs like Quality Works, HBIP, we need that information to be entered correctly. Okay. And this is a snippet from your verification report in HIDE, where you can verify to make sure that your swing bed records are entered correctly and are showing. You'll see that as separate from the inpatient, and you can always verify that report. I think that's on page 2 to make sure that everything is in there and showing. This is an example here where you can see a facility with swing bed patients. And again, these are also other, this is demographics information, which we found that certain people were having issues, especially in 2018, with the ethnicity and what numbers or how to categorize them, and race and gender. So that can also cause fluctuations in your data distribution if you don't put in the correct number when entering, ethnicity or race or any other demographic information that's important for that data. And so when you enter that information using those codes, because sometimes the facility have other codes that you use internally, but for that particular file, you would have to use those codes. So just 1 and 2 for ethnicity, and then 1 through 7 for the race. Those are the 2 that I see had the most inconsistencies. So, and again, this is just an example of how to look at your bill types. So when you're the data uploader, when you're into HIDE, you can click on your batch ID number, and it'll show you kind of a summary of everything that was submitted, who submitted it, and what was submitted. And as you can see, it'll show you your bad bill type. So if there was just a 1, that's not a correct bill type, or any other number that doesn't show on that form, at the bottom, it'll give you the records that were not loaded, and that'll show you why. And usually it's because it's a bad bill type. So going back and making those corrections will ensure that your data is valid and that the distribution and volumes are correct. So if you see that volumes kind of fluctuate compared to your system in HIDE, usually it's because it wasn't entered properly. And so just look at that after you submit the data to make sure that everything is entered correctly and that no records were dropped.
I guess I need to put you in there.
Just a reminder that I have unmuted all the lines, so if you are having a side conversation, if you wouldn't mind please muting yourself, that would be very helpful so that we're not hearing your background conversation.
That was pretty much it. If you have any questions regarding bill types and how to enter your NPI number.
Well, I'll look on there and see if I can't figure it out then.
I just muted.
Yeah, just you can either I guess, say something now or ask me later, I'll be more than happy to help you understand and look over your data.
Anybody have any questions about this?
Folks, we wanted to go ahead and add this to this agenda today just to reinforce it is very important for folks, especially on that NPI. That's where we're seeing a lot of issues where, you know, we noticed it with our readmission modules where hospitals had extremely high readmissions because it looked like it was an inpatient admission right after an inpatient admission. The state also looks at this data as well, so it's very crucial that we pay attention to what's on there, like I said, especially that NPI, so that they can look at the appropriate service types and things like that. They use this data for, you know, allocation of Jerry psych beds, open heart procedures, all of those kind of things too. So, you know, please make sure that at least that NPI is in there and populated correctly.
I'm going to pause again for any questions. I did mute everybody for a moment because I could hear background noise on somebody's, but I've unmuted everyone again. Does anybody have a question for Sharifa or on this topic? Quiet bunch this morning.
It's cold, of course.
Yeah.
It's cold, colder. It is.
But I want to add, too, that if you have any issues understanding that UB04 or how to map it, or you can always contact your vendor because they should have a copy of it, and that's what they use to map the data file. And so if you have any questions, you can contact them, and they can kind of see where, you know, if the MPI isn't in the right position, and that's usually all it takes. And then, of course, using the bill type to make sure that it shows up and it's counted properly.
We also have the UB04 layout located on the on our data services resource page, and I'm going to show you a couple of things on that. So I'll make sure I reference that when we go live to that page. But that is available for you to download. It's just a PDF file. All right, moving on. We wanted to talk about the data services user resources. So logging on to the GHA webpage and going under data services, go back one, clicking too quickly, but you click down on data and you're able to see the Georgia Discharge Data System. And once you click on that page, it takes you to this screen where you see a choice for member reports or data services resources. You also can look at past presentations where that red arrow is pointing. That's a link to our YouTube channel. We have things posted there like these user meetings. We also have the recordings of the webinar that DataGen did for us back in, I believe it was April and May. So any kind of educate, and Sharif has done a couple of educational videos on how to review your verification reports. So if you have a new user, they could go ahead and, you know, kind of get ahead of the game, looking at how to review the edit, summary, detail, and the verification. So take advantage of those. This is a quick screenshot of our YouTube channel. When you do click on that view recordings, this will take you to all of the webinars that we have available for you to view on our YouTube channel. When you get to the screen where you can choose between member reports and data services resources, the member reports, we gave all of the C-level folks at facilities and the marketing contacts access initially, but we have certainly since added others who, you know, need to have access to these reports. Bill, do you want to give a description of what kind of reports are there?
Yeah, these are the places where they are static reports, and you can see we've got them bucketed into kind of 3 different folders. Some of them we generate, and some of them that we get from our partner with the Hospital Association of New York State. Economic impact report, I think we have the last 2 of those, and for whatever reason, I've gotten a lot of requests for those in the last couple of weeks. I don't know if folks have to do their community health needs assessments, and this is just that window that they're all doing them, but we've had quite a few requests for the most recent economic impact reports. Within the finance folder there, that's where we model, or we get models from various policy decisions, the inpatient prospective payment rule, and then the interim rule, the final rule. So we've got in there's probably 10 or 12 different models of what the regulations and proposed rules have been out there on each individual hospital. If they do, we can roll them up to the individual system as well, but a lot of those are at the facility level. Policy, same thing, the kind of more of the economic models. The last folder that we have is the quality tool. That's where we get anything around HCAHPS, the value-based purchasing, critical access hospitals, scoring, things like that. There's not a regular flow to when the reports come out. It's all based on kind of the federal fiscal year when they propose rules, and then when they have final rules. So we'll see a flurry of them. The quality reports do tend to be more quarterly as we get releases from MedPAR data and hospital compare data and places like that. So it's a little more routine, but the finance and policy tend to flow with the federal fiscal year when they have to roll out their new proposed regulations. We send that out as an email when we have new reports that are out there, and this is the format that we went. The last one was October the 11th. You can see, the inpatient psych final rule, the LTAC final rule, cost report information that's out there from Q2 2019. But you can also see that this was a quarterly one where we had a number of the reports in the quality folder. Like Leslie said, we started this with all the C-level and then anyone that they have designated to have it. So I think this email goes out to a couple of hundred folks whenever we have it. And unfortunately, like I said, we can't always say it's the 3rd Wednesday of every month or things like that. It's just whenever we get those reports. Most of them come out in batches, so you'll see 3 or 4 in the finance folder, 3 or 4 in the quality folder at the same time. We very rarely just release one unless it's something time sensitive like wage index data and things like that. But tends to be more on the finance, government relations, and the quality side.
Thank you, Bill. Just really quickly, I wanted to go live to our website and just show you what is under data services resources, if you can see that. But let me scroll over here. So we've tried to post, forms like I was mentioning. Here's the Georgia UB04 record layout in a PDF format that you can download. The submission schedule. We have notes to the study. We have data authorization forms where you can download the custom data request, the limited data set order form, authorization for the readmission analysis module, and authorization for the strategic planning visual tool. So all those are available if you need them. Also, if you work with a consultant, we do allow hospitals to authorize consultants for a period of 60 days at a time to work with the online data, so we'd be happy. We just ask that you send a copy of the consultant data use and confidentiality agreement between the hospital and the consultant so that we have that on file. I'll pause. That was a lot that we just went over. Does anybody have any questions about the reports and the data services website?
Do you have any plan to do like a financial impact of the proposed Medicaid changes, or are those reports more national trends, filtered?
No, if we're able to do them and able to do them at the individual hospital level, yeah, that's certainly where we will post those reports.
I'm going to.
This is where we also combine the GDDS volume that we get with some of what Carrie Summers especially will model on those impacts.
Okay. Thank you.
Any other questions? All right, we're going to toggle over to the visualization tool. Let me see if I'm still logged in here. A couple of quick tips just to remind you that when you're working in the tool, if you will click pause before making your selections, then it speeds up the process where you can make all of your selections, such as if I wanted to select a few counties here, it pauses the screen refreshing with your selections. So as an example, if I wanted to choose some metro counties, it would be easier to do that. And I'm sure there's more of a lag. And I didn't have pause, but if you do click pause down there, it will pause the refresh, and then you can resume. You can see that now it is paused, and so if I want to select more counties, I think we were on, we'll look at Gwinnett. So then you can look at what you do have selected here. And I've got Cobb, Fulton, and DeKalb and Gwinnett selected. And then you can click resume, and it'll refresh with the selections that I made. Anyway, that's just a tip to help you work in the tool a little bit faster. This tab is kind of the starting point for if you wanted to look at your market share. You could select the major counties in your area or county if you're a more rural hospital of where your patients may be going. So you could select the county, and then you would be able to see what facilities they went to. You can narrow it down by service line. It'll list these zip codes out for you and the payer type. So this is kind of the starting point. That's why it's the first tab of the strategy and marketing screen. Also, what we wanted to highlight today is the data export tab that we've been talking about, and we showed a preview of that on our last call, but it has been made live. And again, on each of the tabs, the specifications or the criteria that you filter on, they do not carry over from tab to tab. It's kind of just set at default. So if you're working in one tab, you need to, and you move to another, you'll have to enter new filters or specifications that you want to see displayed. On this data export, we had a couple of challenges trying to get this out. One of the things that we are still working on is having the length of stay available. And I would like to ask, if a few of you could chime in or chat back how important that length of stay is to you. Right now we only have the count of discharges. The length of stay was causing, because it's a calculation, for each calculation, so one calculation was the number of discharges and the second was the length of stay, and it was the output was creating a row for each calculation. So we felt like that might be awkward and cumbersome for users. So we had the vendor take it off for the time being while we would look for a better solution. So do you have any thoughts about that? Everybody's unmuted, so please, we need to have some interactive conversation as we continue to enhance the functionality of this tool. This tab is intended to serve as your, data export functionality, especially for those of you who are not subscribing to the limited data set. So on this tab, what you're allowed to do is export a quarter of data at a time. You can filter on all these filters above here. Again, I would encourage you to pause the refresh while you make your selections. So we will look at inpatients.
Leslie, I do have a question because I noticed that this was put up this morning.
Yes.
And I've been using this for the past week or so, and I've noticed you put the DRG tab earlier this week and then this. And I do have a question. When you select the patient type and you select outpatient, I noticed that there's no selection or anywhere to be seen on here that like ties back to AmSurge, unless I'm wrong. Like you have the admit type and you've got like other, emergency, elective, etc. How would I tie that back because the other ones have AmSurge, like the other tabs on there have AmSurge, and then this one does not?
So this one we just grouped by by inpatient or outpatient. I see what you're saying. We can take a look and maybe take that back to having the more, I think on the market trend analysis, we have the choices for, so you want these choices on the data export tab?
Well, it's not that I need them. I just want to know, am I comparing apples to apples? Like if you go back to the data export tab, because I like that tab a lot better than these. But I just want to know, like, if I were to select, once you go back there, outpatient patient type at the top, and then you go down and you select the admit type. So if you limit that to outpatient, the patient type, so you're second left from the left on the top, next to facility. So you select outpatient there, and then you go down to the very bottom right, the admit type. Which of those, elective, emergency, which of those is going to be your AmSurge?
I need to check to see if that, when you select the patient type, if that's triggering, so you're asking if you, for outpatient, how would you identify the AmSurge on admit type?
Correct. The nomenclature is just different.
Well, patient type and admit type are two different, as you know, I'm sure you know that they're two different data elements. So,
so there's just no other option on here to like see AmSurge, basically.
Right. I think the best option would be to change this patient type to the broader spectrum, to making it those 5 choices instead of just inpatient or outpatient. Would that solve your concern?
Yeah.
Okay.
Likely, yeah, if it would just match like what it had earlier.
Okay.
On the other side.
Service line for procedure code. Can you figure it out from that?
I'm sure you could use service line or procedure code, but I think that just doing it by patient type would be less cumbersome. So we're making a note of that. And thank you very much for your feedback, because that is exactly what we need to know is, we also are, well, we have the age brackets on here. There are a few other things that we had talked to the vendor about incorporating, and so they're working on that for our next update. And one of those, again, as I mentioned, is the length of stay days and the average length of stay, and how to best incorporate that into this screen so that it's an easy export for the user. So keeping with this, we'll leave it as outpatient. I just wanted to give you a quick example, and I'm just going to select a couple of counties so that we have a smaller data set to work with.
When they do make these updates, are you going to take this tab off? Because I've noticed in the past, like, DRG was available at one point and then it was gone. Like, do you take these down as they're working on it?
No, we found an error in the linking on the DRG tab, so we because the data was not reporting correctly, we disabled that while it was being repaired.
Okay.
Yeah, it was it multiplying?
It was multiplying everything by 12.
Yeah. It was obvious that it was an error, and it was with the last data refresh, so we just, we didn't want anybody accessing it because it was so off, so we just took that one down. But usually we make these changes on the fly. The age brackets were added on the fly. Those kind of things have been added as we needed.
And we are able, especially when we're launching something new, internally we are able to look at it in a test environment and try to catch anything that's obvious. But we do rely on you and this meeting, but not only at this meeting, to reach out to us. And I know one person in particular has been very helpful in providing her feedback, and we really appreciate that and ask that you continue to do that. So by default, these are the columns that, one also thing that you'll notice when the data is exported, it will only say column 1, 2, 3, 4, 5, and so you'll have to, put in a column name, unfortunately, when you export the data. But you are able to select different output fields. So this is the list of output fields. We mimicked this from literally what you had before in the user-defined export from our previous tool. So I'm going to come down and resume. Hopefully it won't take too long. And then what you need to do is just click in the kind of blue-gray area that says Data Export Dashboard, and then click on the download down at the very bottom and click Data. And it'll just by default show the first 200 rows, but you can then download all rows as a text file, and it automatically will default to opening with Excel. And here is the data export, and as I mentioned, it will have column 1, 2, 3, 4, 5, and then it's a Tableau thing that it exports this rank, and so we have this ignore message here. So literally you can always delete column F, and then it gives you the number of records. And this is the number of discharges or encounters, so to speak. Again, what we are looking to do is to be able to add either the length of stay average or the length of stay days here as well for you. Or I guess another question for you is, how would it function if you had a toggle, as on the market trend analysis, I believe you can export, if we had a toggle where you either exported the number of discharges or the number of discharge days, how much of an issue would that be if you had to do 2 different exports and try to link those 2 data files up? Any thoughts or feedback on that?
That would be tricky.
Go ahead. It would be much easier to have both on the same export.
That's what we were thinking.
I agree fully. I just wanted to...
That was a workaround that we were thinking might work, but yeah.
I guess initially we didn't take into account that length of stay was really being utilized, but from what we've heard from just a few users, that it is.
Leslie?
Yes.
This is Martin at Erlanger.
Hi, Martin.
Hi. The thought I'm having is that it looks like you can only export 1 quarter at a time. It would be very helpful if you could put like a beginning discharge year and quarter and an ending discharge year and quarter.
We had to do the quarter by quarter for several reasons. One, just the ability to download that amount of data. We were having some issues with that with our previous tool, that folks were just downloading massive quantities of data that they may or may not have actually needed for whatever purpose they were using. But the other reason is performance, just the ability to segment it quarter by quarter. It returns the results much quicker, and it doesn't bog down.
We just along with our vendors recommendation, we decided to launch it just with the capability of a quarter at a time, just to see how it functioned for everyone, and then we may be able to look at testing 2 quarters at a time, but especially on outpatient when you're looking at so much data, you know, and it just depends on how, you know, if you select, you know, 20 zip codes.
Yeah, all
and
outpatients,
all
20
outpatient
counties. Yeah.
Right, for all facilities. I mean, that's really going to, the performance, and it may time you out before the data ever actually gets exported. But we have a kind of a bi-weekly call with our vendor, and we can bring up these issues. In fact, one of them may be on the phone listening right now, but we promised talking points back to them and suggestions once this call is over.
All right, thank you.
So thank you, Mark. We will take that into consideration and see if we can expand the capability. Any other thoughts, comments, suggestions? No? Well, while you're still thinking, could anybody give a suggestion or for topics for the next call or for the next year? We've already started looking at the dates for next year. Need to resume that. Next year's meetings, I've already listed those out. Our next meeting will be on December 4th, but we want to make sure we're using your time wisely and providing you with the support and information you need. So would love to hear from you a couple of things. One, topics for this call, but also would really appreciate somebody volunteering to talk about how they're utilizing the tool or how they've used it, a case in which you have, you know, gone into the tool and done a marketing report or migration report. Would love to give any of you the opportunity to, you know, kind of give a presentation of how you're using the tool. I think that would be helpful to others.
And the other thing too, a lot of this we get because hospitals have given us specific requests of what they need to do to fulfill CON applications or community health needs assessments, things like that. So if those are, you know, if you're struggling with how to do that within this system, email us and we'll figure out how to incorporate it. I know that's where the age bands have come in. That's where a number of different things like that have been incorporated that we thought were maybe not necessarily minor changes that we didn't think about at the beginning. But it was an easy fix that we knew that was a mandate, that we now know is a mandate to have.
Any last thoughts or feedback on the visualization tool? Well, as we wrap up the year, again, just a quick reminder that we will be closing the third quarter on the 15th, and then that data should be released and updated mid-December on the visualization tool, and if you're a limited data set subscriber, that data will be released probably around the beginning to mid-December. Also, the first user group meeting in January actually falls on New Year's Day, so we will not be having it then. We will have it on January 8th, which is the second Wednesday of January. So this is the schedule for 2020, which I can't believe is almost upon us. So thank you for your time today. We will be posting the recording by the end of the week to our YouTube channel. If you have any questions, don't hesitate to give us a call. We welcome the opportunity to do webinars with you or your team. We can do these Zoom meetings and do specific demonstrations We also can do specific data requests if that's necessary, if it can't be done through the visualization tool. So just please let us know how we can help you and support you in what you do day-to-day with the data. Thank you again for your time today, and that will conclude November's Data User Group call.